Awesome. Well, thank you all who are here with us and joining us, Pure Health Exchange, for our first CEO coffee chat. My name is Angela Glymph. My pronouns are she, her. I am the CEO of Pure Health Exchange, this wonderful organization I've had the privilege of working at for the past 9 years. We are a health equity organization whose mission is to provide health education and health resources for and with young people across the nation. And I am here with an amazing leader, Ashlee Wisdom, who I am just ecstatic to have join us for this very first coffee chat. And it comes on the heels of Mental Health Awareness Month. We're in Pride Month, and we have Juneteenth coming up on Monday. So lots and lots to dig into and to celebrate around equity, around liberation, around education, around empowerment. And I couldn't think of a better person to really kick off all of this celebration with other than Ashlee Wisdom. Ashlee is the co-founding CEO for Her Hue. We're going to hear more about her work there and all of the health equity work that she's done and sort of her journey coming into this role. And so we're going to dig into it. I want to just share with the audience that we have a number of folks, young people specifically, that have submitted questions to us. So we definitely want to make sure that we uplift those questions. And if time permits, for those of you who want to drop questions or comments in the chat, we will be monitoring those, and hopefully we'll get to answering those as soon as we can. So a little bit about Ashlee before we dig into the questions. So I mentioned she is the founder and CEO of Her Hue. Ashlee received her Bachelor of Science degree in psychology from Howard University and her master's in public health from NYU. Her vision for Her Hue was born out of her frustrations observing how structural racism impacts healthcare and health outcomes. Her Hue, in case you don't know, is a digital platform that connects Black women and women of color to culturally competent and sensitive, very important, healthcare providers, and offers health information and content that centers their lived experiences. So, without further ado, let's dive in, Ashlee. I think folks would be interested in knowing, how did you end up where you are today?
I just have to say I'm so happy to be in conversation with you today, Angela, and so proud of the work that Pure Health Exchange is doing, and really grateful and honored to be a part of that work. I guess to dive in to share where or how my professional trajectory led me to Her Hue, it was not at all linear. So I shared with folks that I was supposed to be a doctor. My family's from the islands, from Jamaica and the Bahamas. And when you're a first generation young person, your family wants to make sure that you come to this country and you get all the opportunities to have a safe and secure life and career. And so becoming a doctor, a nurse, a lawyer, an engineer, those are all of the safe jobs that immigrant parents sometimes really want their child to pursue. And so when I was at Howard, I was pre-medicine. I really wanted to become a pediatrician because I loved doctors who liked young people and loved children. I was really drawn to that. But during my time at Howard, I realized that I actually didn't really want to be a doctor. It was kind of something I said it once and then my family kind of latched onto it. But when it really came down to it, I realized that I was only pursuing that medical degree because my family wanted me to become Dr. Wisdom. And so, college is a time where you get to learn yourself, your interests, and I recognized that I was pursuing something that really wasn't what I wanted to spend the rest of my life doing. And so part of that realization actually came from me volunteering while I was at Howard for Pure Health Exchange. So I was teaching a health education curriculum to a school in DC, and I really enjoyed that experience. I was giving information to young folks to make healthy decisions for themselves and to empower them with being able to make informed decisions that brought me a lot of joy. And it was still tied to healthcare. So I was like, okay, I'm not completely disinterested in healthcare, but I don't want to actually be a doctor. And the program director at the time for Peer Health Exchange told me there's this whole world of public health that you could pursue. And so during my interview process for become a Peer Health Exchange volunteer, I started to do some research on public health and realized that that was actually the path that I wanted to pursue. So I got my master's in public health from NYU. Before that, I was working for a community health center as a grant writer, so writing grants to secure funding for a community health center. And my time working in that space made me realize how inequitable the US healthcare system is. Like, why do we need safety net organizations like community health centers? Why do people not have insurance? Why are people underinsured and not being able to access the type of care that they need and deserve? So all those questions started to bubble up for me when I was working in that role. And that led me ultimately to get my master's in public health. So I did that, worked for an academic medical center here in New York City where I'm based. And my time working in that setting also showed me how institutional racism works in some of our leading healthcare systems. And that was very jarring for me. And so grad school, reading about all the disparities in health outcomes that were facing Black women, and then working within a premier academic institution and seeing in real time how institutional racism manifests, I got really angry, really angry and deeply saddened by the reality of healthcare and the state of affair for healthcare for Black women. And I was always a creative child. And so I'm someone who, when I deal with anger or like really intense emotions, I have to find some way to get it out of me. And as a child, that was journaling, writing poetry. And as you know, with Health and Her Hue, it was birthed because I needed to channel that rage and that sadness into something constructive. And Health and Her Hue was birthed. So I didn't really set out to build this business. I really was angry and burdened by this problem and set out, instead, that I wanted to be a part of contributing to the solution to this problem. And then Health and Her Hue was birthed, and it actually became the big idea and vision that I had. It came, or it's coming to fruition, but I would say that I didn't really set out to become an entrepreneur. I didn't set out to become a venture-backed entrepreneur, but my passion for social justice, equity, healthcare, and my deep care and concern for Black women and girls is what led me to where I am today.
Awesome. Thank you for sharing that. And I will share on that note. Well, first of all, just point out we have a lot of commonality in terms of our trajectory to the work that we're doing today. And so I do want to touch on that a little bit. But what I will say, how did I end up what I'm doing today professionally, like you, Ashlee? It wasn't linear. If you were to ask me maybe 5 years ago, 20 years ago, would I ever dream of becoming a CEO of a health equity organization, like I probably would have laughed, to be honest. So my background is in psychology. So I attended undergrad at University of Maryland, Baltimore County, majored in psychology. Then I transitioned to Howard University, which is one of the things that we share in common, to do my graduate studies in psychology. And I wanted to become a medical doctor when I was younger. I ended up becoming a doctor, but not an MD, a PhD. So that's a whole nother story. But yeah, I trained to be a psychologist and really spent a lot of my early training in research. That's what I wanted to do. And my passion was in health and education. I've always was drawn to education. As a child, I wanted to be a teacher in the early years and switched to I wanted to be a doctor. So health and education and equity was always something that was my passion, something that my parents sort of instilled in me. Early childhood experiences, volunteering in both of those spaces. And so I am doing sort of what my passion is, but how I got to it wasn't on that straight linear path, which is awesome to sort of reflect and to think about. And I think for young people who are listening, right, like life can take those interesting detours and you never know. But I think what I'm hearing from both of us is that there was some truth to our passion or our core that we're doing and living out, but it may not have been in the way that we had envisioned for ourselves. And so speaking on those commonalities, Howard University has definitely influenced who I am and where I am today. So I do want to dig into that because that is a connection point for both of us. I actually started my career at Peer Health Exchange working out of Washington, D.C., and I spent a lot of time with our PhD volunteers like yourself, who were actually conducting workshops in Washington, D.C. So that's sort of also that common thread. But let's talk about that. So how has Howard been an influence to who you are today and what you're
I
doing
love this
today in your
question.
career?
So Howard, I owe so much to Howard. It was an institution that nurtured me in a way that I didn't know as a young person. You're 18 years old sometimes when you go off to college. I didn't know that I would need that level of nurturing before I went out into this vast world that oftentimes, unfortunately, is not very kind to young Black women. And so I felt very supported by professors. I also just enjoyed being around so many brilliant Black students, and having that not feel like an anomaly, but it felt like the norm. And so that does something good for the psyche when you see all these other brilliant Black folks around you. You're like, we are brilliant people in spite of what society tries to say about us. And so that was really, I would say, foundational to my pride in being a Black woman. And then Howard's motto is in truth and service. And that is something that has stuck with me. Like, what am I like now? I've had the privilege of being educated at this great institution. I'm going to go back into the world. And what am I going to do to serve community now that I have this information, this knowledge? And that has always been a question that has stuck with me since I've left Howard, of like, what am I going to do now to make my community better given the information and knowledge that I have? And I always felt like I wanted to do work that was tied and connected to community. And I'm really happy that I can say that without a shadow of a doubt that that's actually what happened. But yeah, Howard was just really foundational to instilling pride, instilling a deep sense of social justice and equity, and wanting to find work that allowed me to pursue that. But then from a personal and emotional and psychological standpoint, I'm glad that I had that safe space in my formative adult years before going into spaces where I was the only Black person or only young Black woman or Black women, period. Howard prepared me for that. It sounds crazy because like you're around all these Black young people and then you're saying you're prepared to go into a space that isn't predominantly Black. But because of the sense of confidence that I had and then that was instilled in me at Howard, I was able to be in those spaces and know that I deserved to be there.
Yeah, no, I definitely echo all that you shared. And the only thing that I will add to that, definitely, being at Howard for really 7 years. I spent 7 years there, and pursuing my master's and my doctorate degree there. And I can just remember, being in classrooms and not only just seeing excellence that looked like you, right? But it was also sort of this inherent responsibility. And I say that meaning the topics that were covered or connections to like social issues or social justice issues. One clear example, I remember in my first year statistics class, and I mean, this is a highly technical class. I know we had the same professor, and very technical, but then the examples that were used to cover the subject matter were steeped into like, how do you use numbers and statistics to assess disparities that were happening in DC, in the surrounding community, across the nation. And I didn't have that anywhere else, to be honest. I mean, it was really eye-opening. It was like bringing this subject matter and really showing me like what you can do with these expertise that you have to really address social problems. And it was almost like expected that this is what you're going to do with this education that you're going to get here. So for me, that has always stuck with me. And then there was something that you shared from this past commencement from Howard and the keynote speaker, one of the keynote speakers that was there, Raphael Warnock, who, as we all know, is elected as senator in Georgia. And I'm probably misquoting, but here's the essence of what he said, is that your life's work can't be completed within your lifespan. And if it is, it's not sufficient. So misquoted a little bit, but the point, I mean, when I saw that, that is sort of what I felt being at Howard, because I knew and I felt every day that I was benefiting from the work of folks that came before me who had that motto, right? Like that was the reason why I was there and was able to do what I was doing. And then it was sort of that expectation, like you're planting seeds. That's what you're doing on this campus, and your work should extend beyond. So kudos to Howard, HU. All right. Well, awesome. Okay, so we are here, as I mentioned, we're in Pride Month. We have Juneteenth that's coming up. Lots to reflect around liberation and equity and education. So I'm curious, how are you celebrating Pride and
so
Juneteenth?
For Pride, I think it's always, for me, as someone who doesn't identify as LGBTQ+, it feels important for me to center the voices of those who do come from that community. And so I've been spending time reading some of my favorite queer writers, folks like Audre Lorde, who I love her work, and it's always helpful for me to revisit it, to center myself in the work that I'm committed to doing. Roxane Gay. I'm also I love music, so Janelle Monáe has a new album that's coming out. So really just engaging with and listening to the work that has been done and created by folks who identify as LGBTQ+. That's how I'm celebrating.
Awesome. Well, my day-to-day is, doing work in service for or with young people, always. And so for me this year, I really wanted to focus on the young person in my life that calls me mom, which is my young son. And I really wanted to really celebrate with him, educate him about, why these moments, why we're celebrating Pride, like what's that about? Why are we celebrating Juneteenth? And so we have been engaged in some books. So I definitely want to shout out an author that I absolutely love. So for those of you who have small kids, Megan Madison is an early childhood educator and scholar and has an amazing suite of books on how to discuss sensitive or hard to talk about topics with young people. And it ranges from inclusion, which is the one that we're centered on, just given that it is Pride Month, but, body, autonomy. She has books on grief, just a host of different subject matters, but that one in particular that's centered around inclusion is the one that we're focused on. And he's a part of a book club. And so we just got our Juneteenth book this month. And so that's the one that we're going to be reading. And then there's some community activities, both celebrating and uplifting Pride and Juneteenth that we are going to be a part of. But for me, it was really important, I think, really, which is why I do the work that I do, right? Investing in the young people. That's the thing. Into Reverend Walnock's quote, right? For me, that is how my work extends beyond my lifespan, is really planting those seeds with young people. So that's what I'm doing, and that's how I'm
I love that. That's so exciting. And I forgot to mention that I'm also planning to attend Harlem Pride. So I live uptown in New York, so I'll be at Harlem Pride. But I love what you said about planting seeds in the next generation and making sure that the next generation of adults will be centering inclusion and equity because it's been the norm that's been deposited into them. So I just love that.
Awesome. Okay, so we got into this a little bit, but what do you love the most about?
I love that I get to wake up every day and know that the work that I'm doing is positively impacting Black women. Whether it be from the actual product that we're building, we develop content that centers health content that centers the lived experiences of Black women. And so when we have our content shoot days where we're recording video content with these Black doctors, one of the prompts that we ask them to address is, what is your wish for Black women and girls? And every time a doctor or clinician responds to that question, I'm just sitting there in awe that, like, I really get to do this work. Like, I am getting paid, even though it's my own business, I'm getting paid to like sit here and center Black women and girls' experiences and reimagine what a liberated world can look like and feel like for us. And it feels like my calling, and I feel very privileged that I get to wake up every day and do work that I literally feel like I was put on this earth to do. So that is, I would say that's really what it is. And getting messages from Black women or even young folks who are like, I love Health at Her Hue. You're the founder. Like, I didn't know who was behind it, but the company is like so impactful. Getting those messages like really make me happy and keep me motivated, because the work is not easy. It is very difficult, but I wouldn't trade it for the world because of the impact that I know that it's having on women and girls who I care deeply about.
I love that. I love that. For me, I mean, doing equity work in health and education, like I mentioned before, like I do that whether I'm getting paid or whether I'm not getting paid to do it, to be honest. And it's always a bonus when you get paid to do the things you love. But seriously, I mean, this is what I do outside of my title at Pure Health Exchange. I'm still doing this work. So it's absolutely a passion for me. And I think for me, it's just like I have to pinch myself sometimes, because I am actually getting to do the work with young people. I have a unique opportunity to amplify their voices in ways that just weren't available for me when I was a young person. And so, but I always knew, like, I have voice around certain things. Like, I wish I were asked to contribute, and that I get to make those opportunities for young people. It's just empowering, and I get to learn from them. I mean, that's the other thing. Like, I don't know everything. I'm a very, very humble leader, but I love to learn. And I know that young people and appreciate and have benefited, right, from the expertise of young people, and especially now, right? This is a very different time being a young person than when I was a young person some decades ago, right? And so, so therefore I'm not expert, right, on how it is to be a young person right now. And so just being in a position where I get to hear from, work with, even at times being led by or directed by young people from across the country is one of the things that I absolutely love, and I don't take for granted. And it's just, allowed me to be exposed to things that I didn't know about, to meet different people that are also doing equity work, health equity work. So it's just an amazing thing.
I love that you said that you're enjoying learning from the young people that you're serving. Because I think sometimes when people think about expertise, it's like the credentials, the degrees, years of experience. But I'm always of the mind that like lived experience is the highest level of expertise. So I love that as you're doing this work in the capacity of CEO of Pure Health Exchange, but also even outside of that, because this is just your life's calling, that you're learning from the young folks who you're ultimately serving. I think that's really beautiful to call out.
Awesome. I appreciate that. And you're an excellent model of that too with Health in Her Hue, right? Like, your work is really centered around the experiences of women of color and Black women. And you also model sort of like, hey, this experience is what we need to be centered around. Like, this is what we need to be grounded around. So also getting to learn from other experts like yourself is what this opportunity and what my job entails as well. So very fortunate. I do want to switch gears though, the other side of that, which is, what is the most challenging
think
part about your job?
one of the challenging things is getting people or having to communicate the value proposition of Health and Her Hue in a way that honors Black women. Because, we're a venture-backed company, so I have to, have meetings with investors, and even our business model is selling to employers and health plans. And you have to make the economic case, like, to get them to care about why this solution is needed. And so I'll do that because you got to, tailor your story to the audience that you're communicating to. But I would say sometimes it's difficult to have to focus more on the economics versus the moral and ethical imperative of just caring about Black women's ability to live and thrive and be healthy. So that's one of the challenges that I've had to navigate. But ultimately, I know, like, this company needs to exist and you need capital to continue to grow and build the company. But making sure that I'm constantly honoring Black women and our humanity as I'm doing that work. And then, fundraising is not easy. It's not, it's not my favorite thing to do in terms of my list of my job requirements, but it's a necessary part of it. But I will say that also, like, caveated, that I love writing, I love storytelling, and pitching to investors is a form of storytelling. Being able to call out the statistics that and the disparities and like put that in front of investors, I get a lot of joy of being like, here's the stats, but also here's the solution. So while it's not my favorite part of the job, I also do sometimes get a lot of joy out of being able to advocate for Black women, even as I'm, making a business case.
Yeah. No, I definitely hear that and can resonate with a lot of what you were sharing. Yes, so when you're a CEO, there is the business aspect of making sure that, your organization is functioning and thriving and operating and is able to sustain. So those are like sort of the less feely part of the role and the work. And so I definitely can resonate with that. And I think for Pure Health Exchange, just given that, we are in service of young people, and sometimes, I struggle with compelling adults are mostly who I'm talking to in terms of getting the support and the resources, right? Because they are in the position to write the checks. It's not the young people, but compelling them that actually we need to listen more to young people because they actually might know more than us, than you. And let's make spaces for young people. It's tough, especially when we are living in a society that is adultist, right? Like, you're older, you're supposed to be smarter, you have more power, all of those things. And so that is sort of the challenge that I have to constantly combat, which makes it tough. But I will say, in to your point about storytelling, but I get to tell the stories. And I love it when the young people can tell their own stories. So let me be clear. So anytime I'm in a position to make space for them to tell their own stories, I definitely do. But in most cases, that's not possible. So being able to showcase and tell the stories of, right, like how just sitting back and letting them lead and how that really contributed to more positive impact or moving our mission, gives me the joy. So it balances out sort of the frustration that I sometimes experience in this work. But yes, I definitely echo that. That is one of the challenges that I face in this role in leading an organization.
It can't all be, I would say peaches and creams. There's going to be some stuff in there that you're like, this is not my favorite thing to do, but it's still in service of the bigger mission. Right. So you kind of take it with pride.
That's right. Yeah. And I think the other thing is, and I want to know if this is true for you, but you do see progress. So, you're going to have those tough days, but then you're going to have those days when you're like, okay, here's the progress. This is why it's worth it. People are listening. People are getting it. There are opportunities that are opening up to address the inequities that we're combating in our respective work. I don't know. Do you often have those moments, and
Yeah, like
what
I
does that
think
look
one
like
of
for
those
you?
moments happened for me recently in New York. The mayor's office hosted this women's health summit and convened different stakeholders who are
Mhm.
trying to address the inequities and the disparities that are facing women of color and women, particularly obviously in New York. And it felt really good to see policymakers reaching out and saying, hey, we see
Mhm.
you all building solutions. We want to learn from you to help inform policy. And what folks don't know, my concentration was healthcare policy. And so now I'm like in the actual like application of things and building technology. But it felt really good to see or be in a space where the work that I'm doing is helping to inform policies in the community that I was raised in and that I still live in. So that was for me one of those moments of like, health and review is a very specific solution, but like, how are we going to help shape policy, which ultimately shifts things in the direction that they need to be moved into or moved towards? And that felt like I wouldn't say full circle moment, but it made me feel like, hey, this work is not all for naught, because now you're in a space that's helping, that has the ability to help shape policy that can really move the needle in addressing these disparities. So every now and then you have those moments of like, aha, this is why I have to keep pushing through, because the days when it's hard, that those days can be really, really hard. But then, like you said,
Yeah.
the progress is still being made on those difficult days. You just got to keep pushing through, and you'll have those moments of, okay, this work is not for naught. It's actually moving the needle.
Hmm. I'm glad that you shared that example, because it brought up for me an example related to sort of like policy. We got a call, we got an email really from the California Surgeon General, and was like, hey, I'm trying to figure out how to basically reimagine behavioral health in the state of California, that is in service for young people. Pure Health Exchange, we know that you are doing a fabulous job of engaging and uplifting the voices of young people. They didn't want me, they wanted a young person at the table. So I was like, yes, like at least California's getting it, right? Like that's exactly who needs to be at the table to inform, what inclusive, affirming, impactful behavioral health could look like for that young person. Not me, but that young person. And so was just so happy to get wins like that. Like those are the kinds of wins that
Exactly.
makes the job worthwhile, and it makes you get up in the morning. All right, so our time is winding down, and I definitely want to make sure that we are answering the questions from young people and from folks who are joining us. Hello. And so we're going to get to some questions, and then we're
That's
gonna
where
then
it's
we're gonna wrap up and close out. How's that sound? All right, awesome. Okay, so first question young people want to know is, when did you seek mentorship, and how
I
did you find it?
intentionally sought out mentorship when I was in undergrad and college. I was at a point in my life so I grew up as a Christian, grew up in the church, very like strict Christian household, and college was the first time I was able to like leave home and like learn this new world. And so I was going through a moment of kind of just questioning my faith, and not in a negative way where I was like, I'm no longer a Christian. I still am, but I was questioning a lot of the things that were indoctrinated in me. And I really wanted to connect with someone who was a professional, who was an academic, but who also shared the same faith as me, because I wanted someone who I could ask those questions to and not have them push me in either direction, but really just allow me the space to wrestle with the things that I was wrestling with. And I found a woman, her name is Rahel Tesper-Mariam, and I was like, can I be your intern? And that was my way of like wanting to foster a relationship with her. So I was like, how can I be of service to you? You have this website. I want to be your intern and kind of support you with that work. And then through that, she became a mentor for me, and we still have a very great and close relationship.
Yeah, for me, mentoring came into my life in a very demonstrative way when I was in undergrad as well. So as I mentioned at the top of this, I wanted to become a medical doctor. So I had pursued pre-med in college, and then I got to
always the
organic
class
chemistry, and
that
I
will
was like,
do
nope,
it.
got to change that's it, right? That's the one. And I had to change direction, and I didn't know what direction to take. And so I had a professor who was also a Black woman, which was very rare at my undergraduate institution. And I was like, I want to learn more about her and her career and her trajectory. And she took me on, exposed me to the research parts of psychology. And from there, history was made. That I changed my major. I was prepared to go into grad school. And I will say I haven't stopped having mentors. I have not stopped. So young people on the call, it's not a one point in time. I still have mentors today that are very integral in my life, for different aspects of my life. Very, very important to have, right? Because I'm also learning. As I said, I'm still navigating new spaces, and so sometimes it's just really, really impactful and beneficial to have mentors in your life. All right, so this is a fun one that young people want to know. So I would say a few adjectives. So a few adjectives to describe yourself when you were a teen. What kind of teen
I
were
was
you? A few adjectives.
studious, challenging. I know that has a negative connotation, but challenging in the sense that I questioned a lot of things and pushed back on things that didn't make sense. And I also was very, what's the word? I guess logical. Like I needed to hear reason before I could get on board with things. So yeah, I would say studious, challenging, and very creative. Very creative.
Awesome. I definitely resonate with studios. I definitely was into the books. I would say I was well-rounded. Like I was into a lot of different things. Like I played sports, I was into music, I was into books. So I would say well-rounded. Introverted. I'm still introverted. It may come as a shock to folks, but I am. That is who I am, always been. And lastly, I would say insecure. Yeah, I had a lot
That
of
one
insecurities
resonates
as a
with me too.
teen.
I feel like the teenage years are a very interesting phase of life. You're coming into your body, you're making friends. There's a lot going on. So I would say insecurity also resonates with me during that time. I was not secure in who I was completely.
Yes. Well, this one is a really good one. So this question is, what would you suggest for young people who want to make an impact in equitable health, but live in an area that isn't
Yeah, I
receptive to the
love that
conversation?
question. I would say I would encourage those young folks to find a community of other like-minded young folks so that you don't feel isolated in that desire to like advocate and drive impact. And once you join forces with other folks who are like-minded and wanting to drive impact, you will collectively find a way to do so. And then just one, I guess, a tactical way of driving impact in a space that really isn't, I wouldn't say conducive, but isn't as friendly towards your desire to drive impact and health equity. Maybe curating resources in that community that can help support young folks with finding, affirming, and equitable healthcare support. So yeah, so two things: find a community of other like-minded young folks so that you don't feel burdened by yourself. And by joining forces with them, you'll likely be able to drive impact together. And then also a tactical way is just curating resources that can support young folks in those environments to really safely navigate that space.
Awesome. What I love about this question is that I think, unlike when I was a teen, I just didn't have access to the world and to information, because let's just be clear, probably my last year in high school is when we got the internet. So the internet was just born when I was in high school. But like through social media, there's a number of ways, right, for young people to connect to each other, to connect to other communities, to connect to resources. And so there are ways that you actually can achieve that in ways that are much more accessible and easier than when I was, a young person. And so I would definitely encourage young people to utilize, technology in that way. And the young people that we were able to engage at Peer Health Exchange who dreamed up Self-See. So that is sort of our digital platform that is connecting young people, right, to resources and experiences, identity affirming resources and experiences in communities, because those young people had a similar question, right? They had a similar need. And so like Self-See, there are other, tools and means for young people who might be feeling isolated in their communities or living in communities that aren't affirming of who they are. There are communities out there that you can connect to. And so just leveraging technology, I would say, is my advice on how you can do that.
Response.
Awesome. Okay, let's see what else we got here. So the last question from young people, they're really, really interested in wanting to know how we are elevating youth voice in the work that we do, specifically in our careers or even outside
I love
of
that
the work that we
question.
do.
So I would say with the work that I'm doing with Health and Her Hue, the platform is accessible to folks who are 18 and older. So I would say my day-to-day work with Health and Her Hue, it's not really the work where I'm elevating young folks' voices per se. But that said, we have young folks who are following Health and Her Hue, and we're thinking through what content can we develop to give them access to educational resources in places that they're already engaging through social media. But I will say my work on the board of Peer Health Exchange allows me to do that. So I love what Peer Health Exchange is doing in terms of elevating youth voices, making sure that young people's voices and perspectives are centered and valued in the work that is informing what Peer Health Exchange is doing. And my job as a board member is to ensure that that continues to happen. So that is the work that I'm doing to help elevate young folks' voices.
Awesome. Thank you for sharing. So, I mean, obviously as CEO of Peer Health Exchange, I get to amplify youth voice in my day-to-day in some, tangible ways that I've done that and will continue to do that is to make sure that, tables or spaces that I occupy, that I start to bring young people and their voices and their stories to those spaces. So, one example that I'm really proud of and honored about is having the opportunity to co-author a chapter in an edited book, the Handbook of School Mental Health, with an amazing researcher from West Ed, Dr. Christina Pate, but also two young people who we and I had a chance to work with in building, Self-See and selfsee.org, co-developing that, but also being able to learn from them in terms of like what made that experience meaningful and how it was impactful to their social and emotional well-being. And when I was invited to contribute to that, I was basically like, well, I'll do it, but I can't do it unless the young people are doing it with me. Like their expertise and their voices must be here or no thank you. So like being able to sort of flex really my power and positionality to uplift young people is, one of the ways that I get to do that at Peer Health Exchange. But I'll say like outside of Peer Health Exchange, I'm usually working on adults. So that's what I get to do outside of Peer Health Exchange. I work on the adults and say, hey, let's check our adultism. Let's start to make more space for young people. So that's what I get to do. Well, we're at time. We're at time.
Yes,
This was such a pleasure and an honor to spend this time with you, Ashlee, getting to know more about you, but also being able to share with the folks who were with us, who joined us, to really hear more about our stories and how we're uplifting equity and liberation in all that we're doing. So I want to say thank you. Thank you so much for all the ways that you've supported me personally, that you support Pure Health Exchange, that you continue to be an equity warrior out here. And the work that you do in health and in Her Hue is so empowering and so inspiring. So thank you for making time, because I know you're busy, but thank you for making time for us and for all of the folks out there who joined us, and for all of the attendees. I know you could have spent your time in a million different ways, but we are so grateful
Yeah.
that you decided to be here with us today. So thank you. Happy Pride Month. Happy Juneteenth.
Thank you,
And I hope to
Angela.
see you
Thank
all
you,
again.
everyone.
Thank you so
Bye.
much.